Ayo Luckies, welcome back to Luck Management. I'm your host, Carter Loesch. We are on day two, officially third day of 30-day challenge. Talking to you direct, live, uncut, no prior recordings to this one. Just straight up vibes right here on a Wednesday, going through what's happening in the world of your host of the luckiest podcast in the world. Just bringing it down into a vibe on as we get into the second half of this week. April Fools. Did any funny jokes happen to anybody? Love to hear if anything was really that good. But it kind of feels like a time that people don't want to joke. As people are in America, they're like, wait, our economy is a joke. Wait a second. There are issues going on at grocery stores and gas stations. Prices are astronomical. That's a joke in and of itself. And we're just waiting. And in this waiting period of, okay, is the joke going to be finished? We have really put ourselves into like a laughable state where people just like listen, hear, and say, oh, this is the reality. This is the world we're living in. But I think in this waiting period, I think that the best thing that you can do, and it follows this whole luck management idea, is that you have to be the enactor. You have to be the one that makes the change. You have to be the one that separates what all the noise is to be able to be the person that you want to be able to accomplish the goals that you ultimately want to accomplish. I've seen that lately in the world of work. I've mentioned it a couple times. I'm now working for a healthcare finance and software team for a company called Preferred Medical. It's been a couple of months since I've been there, acting as a director of revenue strategy and ultimately working with these hospitals so that they're able to recover the revenue from insurance agencies that are not paying what they should be paying to their hospitals. It is a messed up system where we kind of have to be the middleman between this $10 trillion industry where healthcare and insurance agencies are fighting constantly on what services should be paid and what they shouldn't be paid. And it's a wild fact of there are so many different hospitals and there are so many different people going in to get services, and payers like United Healthcare, Blue Cross Blue Shield, Cigna, they create these insurance premiums all hoping that you ultimately don't have to pay. Me as a healthy 29-year-old, I pay into the system every single month for healthcare insurance in the hopes that if I don't have to go to the hospital, at one point I can build that up enough to get the care that I need. And it falls into the hospitals ultimately focused on providing care. They are working on automating their systems and making sure that when someone goes in, they get the care that they need. They get the patient estimates that are all together. And then at the end of the day, once that bill goes out, gets sent to the insurance agency, those insurance agencies deem if they are willing to pay based off of what the contracted rate was. So you have a contract with anyone, the contracted rate is what it should be paid. But what we're seeing on a grandiose scale, and that's why there's tens of hundreds of companies like this, that they do not pay that expected reimbursement rate. They'll pay 70%, they'll deny 30% of claims, they'll underpay on 10 to 15% of any sort of claims that get out there. Even if you're looking at patient responsibility, coinsurance, the way that they make their money is they ultimately just deny everything and hope where the burden of proof does not fall on the actual hospitals. And it's a structure and it's a cycle that continues to grow time and time again. And then you have these other areas where you have the United States government and local governments all deeming these grants towards these hospitals to boost up their efficiency models, to boost their technology, to improve their revenue cycle, all while not being able to essentially hire the manpower and the people to go in there and make those decisions for them that actually get the money in the door. So they employ revenue cycle teams and finance organizations that kind of act like consulting groups to come in and provide these services because we have years of experience and they just want to focus on the patient care. But what we've seen now is administration is starting to become larger than the actual people that devote care. You have nurses that are working countless hours. You have PAs and doctors. If you've ever seen the pit, it's wild. It's pandemonium all the time. There's an issue here, there's an issue there. And then you have these insurance agencies you've seen on the news, the crazy murders of the CEO, or how they continue to find ways to not have to pay. And insurance sits there in the nest egg. It is in the idea that nothing wrong will happen, or that when something does happen, we will be there for you. But ultimately, these services, these small procedures, these things have been exorbitantly pressured and pushed up to a level where people now don't even want to get the care that they want or that they actually even need. They resort or look to peptides, they resort or look to natural remedies. That's why there's been such a huge push towards psychedelics and the advancement of different health alternatives that are really kind of causing a shift in a paradigm variance in the way that we look at what healthcare actually is. And this machine and this ball does not stop rolling. And so you question why the United States and our healthcare systems can't ultimately create a system where everyone gets healthcare and that people are served in the way that they should. It's because there are too many companies, myself including, and there are too many organizations that rely on the revenue cycle being broken. Now, there's a argument to be said that, oh, you should fix these, or oh, this isn't viable, or this isn't the right thing to do. But it is the system that we are currently in, and you continue to exploit or you work through the system in the way that it's established, built, and ultimately going to keep going. And you can talk to your local senator, you can talk to hospitals, and we've tried to put things in place of saying price transparency so that you know what the costs are compared to other hospitals. But there are so many different procedures, there's so many different things that people are just looking to get the care immediately. They don't have the time to shop or to decide which route of care is the right way to go. And so it just creates this bogged down system. If you want to look at how the economy is going, you look at the healthcare space where it's innovative in some of the technology on some of the easier parts or getting those analytics, but it's creating this bottleneck at the end of the day that is quietly pressuring you to make decisions that make you end up spending more money, getting you more confused into the system, and cause these real hard issues that aren't going to fix themselves. I've seen it countless times, and that's what we do. I mean, we've been around for about 40 years to go in there and solve these issues, and yet these issues are growing bigger and bigger. And it's crazy. You'll see critical access hospitals, 25 inpatient beds that are doing $100 million in revenue. So then think of these larger systems, they're doing billions of dollars, tens of billions of dollars through their hospital networks, through their services. And think of the thousands and thousands of claims that come through. It's a crazy, crazy system. Ultimately and extensively, I would love to see a healthcare solution for everyone where you can buy in and that you can give yourself the proper care that you need. But it's just hard and unsustainable right now. And that's why when you say, why can't we just fix this or why can't we just do this? It is so much deeper and on a greater level than we've ever seen before. I would say look towards being able to take care of yourself and find that need of making yourself healthy again, and do that through the small things that you do, from your walks to your eating the right foods. Now, do as I say, not as I do, but you need to take that into control because no one is there as a safety net. No one is there making sure that you're getting exactly what you need. It is just building yourself into the system. So be weary of that. Just thought I'd get into a little bit of the work that I'm doing and trying to solve some of those issues, or at least alleviate for some of these hospitals that are trying to actually give you care. It's a dominant force in this economy, and it's not slowing down. So look into it, try and understand what sort of care you're getting, what your insurance looks like, why you're doing the things in the space, and see if there's an area that you can have an impact. Small change comes from community, so keep trying to find it. But that's just a little spotlight where I'm at right now in the work. It's rewarding, it's cool to do. I think it's valuable at the end of the day. And if you ever want to talk about the work that I'm doing, and how it might translate to your work, or if you feel like you're doing this but in a different division or a different sector, there are so many overlaps that I'd love to be able to talk with you a little bit more, learn about your experiences, and see if that does align. So, as always, you can find us on Apple, Spotify, YouTube, and gotta just say it like I always say it: keep living the luck management lifestyle. Peace.